Hello, everyone, and welcome to Biohackers Lab. I'm your host, Gary Cohen, and on today's episode, I have Dr. Steven Lin. Dr. Lin is a functional dentist who focuses on the mouth-body connection. He has a special interest in understanding dental disease through nutritional principles. This includes ancestral nutrition, the oral and guts microbiome, and epigenetics. Dr. Lin is also a TEDx speaker and author of the international best-selling book called The Dental Diet, The Surprising Link Between Your Teeth, Real Food, and Life-Changing Natural Health. Stephen, thanks so much for coming on to the show today.
Hey, Gary, it's a pleasure. Thank you for having me.
Right. So, I've been following you for a little while, and I love the work that you publish, such informative articles and information about dental health and general health and how the two are linked. And so today, I mean, there's so many topics we can talk about, but I think I want to dive in more into nutrition, food, and how that affects our mouth, but then how that, I guess, affects us systemically, our whole body. So my first question for you would be looking at the first food that most people get exposed to, which is breast milk and breastfeeding, and your thoughts around how that influences our teeth and our gums and our mouth.
Yeah, breastfeeding has a very profound impact on our dental health, and probably the most profound in that where dietary guidelines probably really should be based around teeth and our mouth. And the reason is because we really get some of the most powerful messages from the health of our body from our dental health. And so a child, for instance, that is drinking bottled
Formula
feed and, for instance, not having breastfeeding. We've had a lot of problems with these kind of foods for a long time now. There's actually principles in breastfeeding that are formative to their dental development. That includes the nutrients that grow strong, healthy teeth, but also that grow the nutritive habits that grow the jaw as well. So the upper and lower jaw bones that house the teeth. So breastfeeding, there are some studies that show that kids that breastfeed decrease their risk of braces, so they actually have wider jaws. And this is a big factor I think we have in nutritional guidelines today, is that we don't factor in dental health, and really orthodontic braces and kids that need braces and they have crooked teeth is largely due to eating the wrong thing. And this was kind of my journey into this whole area. And the breast milk and the process of extracting breast milk from a mother's breast really does allow us to see how the nutrients, including the fat soluble vitamins, mother to a child, and even the epigenome, where we know, for instance, kids that don't breastfeed, they actually lose epigenetic markers that will predispose them to conditions like type 2 diabetes and obesity later in life. So there's a profound dental but then systemic roll-on effect if kids fed, and it's a great way to understand in a very simplistic way with very simplistic principles how nutrition should whole body.
Mm-hmm. And so I think what my question would be too is, just having learned a little bit more about listening to some of your other talks of breastfeeding and how it shapes the palate, and that was amazing. So the sucking effect that happens when a baby latches onto the breast creates a more optimal shape of the top of our mouth. And do babies not get that then when they do bottle feeding?
Yeah, absolutely. So a very quick self-dental exam everyone can give themselves is to look at their palate and look at the shape of the palate. Or if you have a child, check the shape and the height, the general kind of color as well of the palate. So just looking up into the roof of the mouth. Now, palates should be, by definition, wide and U-shaped and flat. And that means that the maxilla bone, which the palate is the bottom of, which is, it's the roof of the mouth, but it's actually the floor of the maxilla bone. That means that the maxilla bone is wide and developed. And so the palate is a very easy way to check the development of the maxilla. And so you'll see people today, adults and children alike, with very narrow palates. And so what we can see is the, instead of being a U shape, it'll be more of a V shape. And that's due to the during childhood development not getting the forces that actually expand the palate out, and that all comes from the oral cavity. And so it starts with breastfeeding, where the child presses the mother's nipple up against the roof of the palate, and those forces actually act to begin to expand the maxilla bone and then create space for the teeth. And so we've seen orthodontic braces as a way to correct a crooked dental arch. Well, actually, it's a growth and development problem where we haven't grown properly. And the first messages that a child's jaw and mouth and teeth get to grow and develop wide dental arches is via breast milk and the food that we provide them early in life. And so this continues right throughout life as well. And so studies of anthropological nature show that once we move to civilization, once we take ourselves away from natural based diet, then we begin to lose this wide jaw. We begin to get wisdom teeth infections, crooked teeth, and it all begins with the forces that we exhibit on the mouth. And that's the tongue to the roof of the mouth, which is the palate, nasal breathing, and lips closed. And that homeostatic posture is something that's taught to a baby during breastfeeding.
Yeah, so that's amazing that already at that stage how the shape of our mouth is being affected just by the way that we're feeding. And then I guess now some people are already going to think, oh, but if I wasn't breastfed or if I'm not breastfeeding my baby, what should I do then so that I don't create that high palate effect? Would you already have any tips for anyone at this stage?
Absolutely. So there are two main forces on the palate. Well, actually, let's say three forces on the width of the palate. And remember, we can actually intervene. We can change the shape of an adult's palate now with an orthodontic device, but also via the postural muscles of the mouth via physical messages of force. And so that's the tongue posture. That's the tongue to the roof of the mouth. The tongue should sit up in the palate. And what that does, if you think of the tongue as a muscle system, it's slung into the mandible bone, but it also connects to the base of the skull, and it also connects to the hyoid bone. It's one of the most complex and heavily innervated muscle groups of the body, and the human homunculus roughly has about 40% devoted to the tongue. So it's incredibly important what you do and what you posture with your tongue. And the reason is because it opens your airways. But so when the tongue is pressed up against the roof of the palate, it has all these muscles tensed as they should be. You have a straight posture. You don't have your head tipping forward, which many kids have now. And so having that tongue in the right position holds your airways open, but also exhibits a pushing force on the palate. And so that's what helps to widen the palate in a child, but it can also reshape in a very minimal way in adults. But we have to remember that there's a neurological calm being pressed when you actually push a pressure sensor up against the palate, and so it sends parasympathetic messages to the brain. And so you actually send a calming autonomic message through your body by putting the tongue to the roof of the mouth. So that's one way to expand the palate. The other is by breathing through the nose. So we take roughly 20 to 30,000 breaths a day. And so when you breathe through the nose, it exhibits a force on the maxilla, especially in a child, to grow and widen. And so, I like to say that oxygen is the number one nutrient, but breathing the right way actually provides a nutrient in lots of different ways. And one is via the physical nature of nasal breathing. And so by breathing through the nose and holding the tongue in the right position, and what your mind should be going to is what's happening during sleep. Because if your tongue is flopping back through the day, it's definitely going to be at night. And so breathing through the nose for 8 hours with the tongue in the right posture is probably one of the best ways that you can make sure that your brain is receiving enough oxygen, that you're sending those right homeostatic messages to the maxilla, and you can also remodel and make sure that your teeth aren't drifting. So likely why people today have relapse after orthodontic work is because we don't correct these habits. And so by shutting the mouth and by having the tongue to the roof and breathing through the nose, you can actually prevent orthodontic relapse and prevent drift or getting crooked teeth by having that good facial homeostasis. And in kids, you can correct a kid's dental arch. We practice a method of orthodontics here called myofunctional orthodontics or orthotropics in the UK, which is done by a guy by John Mew and his son Mike Mew, who are very big on how the facial development and the tongue posture is very important. When you change a child's breathing, tongue posture, their face grows naturally. It's quite remarkable. And so we've lost this information. It's quite profound and important, and right throughout life too, not just in kids, but for sleep apnea and people that don't breathe well, they suffer quite severe chronic diseases.
And so do you go through some of those exercises in your book or some of those tips if someone wanted to visualize that a little bit more? Because what I got from that is that it's where you put your tongue in your mouth on the roof of your mouth. And I guess as an adult, that's pretty easy to think that as I'm listening to you, I could put my tongue up on the roof of my mouth and how much pressure I should push. But then, as you said, the mouth breathing, and I'm guessing as an adult, something like mouth taping at night is one way to train myself to try breathe more through my nose. Even mouth, would you suggest then if you're a computer work and you were in an office environment where you weren't maybe publicly exposed to too many people, that to try train yourself, you would tape your mouth during the day too to try force yourself to breathe more through your nose?
Absolutely. It's probably one of the most profound training you can do for yourself. And so scientifically, one of the most interesting studies in this area is that when for people with sleep apnea, when they are trained on the didgeridoo, which is an Australian Indigenous instrument, they actually have found that it decreases and actually can reverse the symptoms and the disease of sleep apnea. And the reason is because they learn to use the muscles of the throat. And that's everything that we just talked about, the posture and the use of the muscles of the tongue. So when you breathe through the nose and retrain yourself to breathe through the nose with the correct posture, you can have profound effects for the body. So I would certainly recommend that people try and do this, whether it's, you can seal the lips. Now, 8 hours of sleep is probably the most important because that's when you're getting the homeostatic messages to the brain. You need to go and enter the deep REM levels of sleep to clear out all of the toxins from the brain, but also obviously push off all the other hormonal cascades that happen during sleep. And if you're not breathing right, that likely doesn't happen. So doing this through the day will help to teach you to breathe like this through the night. And mouth taping may be a way that you help to train yourself to make sure you're not mouth breathing. But some people will struggle with that. So sometimes they need to go through a training period where perhaps it's an hour or two through the day where you're just watching television and with your mouth taped. But one way that people that kind of want to go a bit further is that exercise with mouth taping. Now, going for a run with your mouth tape or doing interval training with mouth taping. Now, that's something that's training your body. And actually, the Indian Army, I think, used to, and it's creeping into athletic circles now, where sealing the mouth during training and making sure that the body can cope with slow, deep breathing instead of the fast kind of chest breathing, and so that you're actually extracting oxygen much, much, much more efficiently. That's a profound way to kind of tweak and really biohack your body. And really I think it speaks to people that do altitude training, and their body learns how to adapt to extract more oxygen from a low oxygen environment. And so you can train yourself to do that just via the way you breathe. And so it's quite remarkable, really.
That is, and I don't think many people would have gone to a dentist who would recommend taping their mouth when they go out for a little bit of exercise to improve the way that they breathe at night and help things like sleep apnea. I mean, that's very novel, and I'm fascinated by that. I need to look more into that. But if we could come back then a little bit more from some of the nutritional stuff, like I said, there's so many good knowledge bombs that you can share. You're just a wealth of knowledge when it comes to dental health and such interesting things like we're just already talking about. But I know the one thing you're passionate about, which I would agree that not many people talk about, and I haven't heard much about, is the oral biome. So like the good and bad bacteria in our mouth, not just the good and bad bacteria in our guts. Could you explain how what we eat or what we choose to eat affects our oral biome?
Yeah, so the oral microbiome is it's a very understudied, underappreciated part of the human microbiome. And so basically it's like the little brother or the little sibling of your gut microbiome. And we're so focused today on, how impactful our digestive system and the trillions of bacteria in the large intestine, influence systems right throughout the body, but we've forgotten that at the start of the digestive system is the mouth, and the oral microbiome consists of trillions of bacteria as well. And it's interesting because we knew that that dental diseases really were attributed to bacteria long before we knew that the digestive system even had bacteria. So tooth decay, for instance, where we've seen it as an infection model of decay, really is actually a loss of diversity in the oral microbiome. And so we know now that there are bacteria that protect against tooth decay, and there are bacteria that protect against gum disease, and there are bacteria that also, for probiotic bacteria, that help against bad breath and other kind of diseases that all happen due to bacterial imbalance. So we should never see that a problem in the mouth is due to infection. That's the end stage. We should see how we got to that stage and really the loss of diversity. And so really the background of the oral microbiome is what we find anthropologically, which is kind of where I always go, is that, when you studies have looked at the dental plaque of hunter-gatherer populations that lived, thousands of years before agricultural revolution and farming. And so what they find is that the plaque we had in our mouths not so long ago really was much more diverse than what we see today. And that's the same as the studies when they look at the hunter-gatherer populations and their gut biome today, and they see, well, they're much more diverse. And so the same thing is happening in our mouth. So what we see in a trend is that as we move into civilization and we start to get diseases of the mouth and the gut and these chronic diseases that everyone has today, it's a loss of diversity. And the same perspective happens in the mouth, where tooth decay, we hear so much about fluoride, we hear so much about brushing and flossing, and okay, they may play a role in certain situations, but the real way to protect against dental diseases, and also you have to remember that you swallow thousands of bacteria every second, that you need to enhance the diversity of the bugs in your mouth.
And this is how people who live more in rural areas or tribes, because I come from South Africa originally, and I can think of people who are still very indigenous, and they don't sort of have modern day dental care where they brush their teeth twice a day and all that stuff. But you look at their teeth and it's phenomenal. It's kind of like the Western A price stuff, and you kind of think, but hang on, how do they not brush their teeth but still have teeth that look so much better than maybe a lot of European people? And you're saying when we're looking at from a biome point of view, that's what keeps the gums and the teeth healthy. It's not the actual just physically brushing your teeth.
Absolutely. The oral hygiene really wasn't a part of any daily regime. Weston A. Price went and studied 14 cultures around the world in this respect, and he showed that none of them brush their teeth. And we know, and I'll give you another tip as well, Gary, is that I see kids today, nearly no kids brush their teeth correctly today either. So the brushing and flossing, the way I like to put it, is like taking a car with an engine problem to the car wash. It's like, it's great to have a shiny paint job, but it's really ineffective when you've got a problem under the bonnet. And so what Weston A. Price found is that these people had green slime all over their teeth, but they didn't have tooth decay. They had very, very low rates. And this is the same as populations all over the world, that we don't get dental diseases until we hit civilization. And then what we see then is once we've moved into the microbiome age now, once we start to analyze the the metagenome and the larger populations of what's happening in the mouth, that the loss of diversity is the problem. Because we were looking at the species that were causing decay, during the 20th century, but it was an idea of infection, and it really doesn't speak to why. It's a very small kind of aspect of why tooth decay happens.
Yeah.
So the diversity and what you're saying about African tribes and hunter-gatherers and people that lived. All they do is they live on a natural, locally sourced diet. They eat the foods that are rich in probiotic species, and also the other side of it, which I'm sure we'll talk about next, are the nutrients that actually protect against dental disease as well.
Mm. Yeah, and so I guess we're already going in that direction. There's going to be certain foods that are harmful to the biome, the microbiome in the mouth, and there's ones that are going to stimulate it. What foods, and maybe it's easier to say, are there any particular types of foods that you would say are detrimental to the oral microbiome, which people, so we're sort of looking at what the best diets are, and I know you've got the dental diet. If you could give some tips there, that foods that people should avoid then that disrupt this biome in their mouth.
Yeah, so in the dental diet in the book, I try and frame a broader understanding than just removing sugar from the diet, because we know that sugar is bad for our teeth, but let's start with sugar, for instance. And why is sugar bad for our oral microbiome? Well, simple sugars that we eat today, and which we are exposed to via packaged foods and soft drinks and everything else that we eat from the supermarket today. Simple sugars feed a certain type of bacteria in the mouth, and these are the fast metabolizing bugs. And so these are the bugs that cause decay, your strep mutans, your certain lactobacillus species, and they are quick in metabolizing. So they take these simple carbohydrates and they basically spit out acid. So in the oral microbiome, that's how they begin to they shift the acidic environment, or the pH of the mouth, that can then break down tooth enamel. And what the microbiome fantastically does is it actually manages this balance of slow to fast bacteria. So when you eat sugar, there should be a protective factor. And so simple carbohydrates, including so sugary drinks and all the other added sugar we get today. But the other factor is white flour. So white flour is also a simple carbohydrate. It has a very simple metabolic effect on the biome. So these similar bugs can thrive with exposure to white flour. And then the other factor is vegetable oils. So refined vegetable oils that create inflammation in the oral microbiome, and that really is unfamiliar to anything, any kind of bacterial species has been exposed to. Those three big factors, so sugar, white flour, and vegetable oils, are the ones that will cause damage. And when I say damage, loss of diversity to the oral microbiome, and then the flow-on effect to your gut.
Okay, yeah, and I mean, those are some of the big three that people would eat when they have more processed foods versus real foods. So it sounds like, and I know from reading on your website that you enjoy more like the Paleolithic kind of diet. But then if someone is more on a low carbohydrate diet or even on a ketogenic diet, would there be any issues being on those kind of diets that could negatively affect the gums or the teeth? Do you think?
The only thing I've seen with some ketogenic diets is that people they do get they can get issues with bad breath, so they get ketogenic breath, and so they can have a gas production into the mouth, and that I attribute it to there may be an imbalance in the digestive microbiome and the oral to start with, and so that's what I've seen certain people on a ketogenic diet, but generally. The ketogenic diet really is removing the simple carbohydrates that we haven't had access to for a very long time in civilizations, before civilization. So I really, the ketogenic diet is about getting back to real food, understanding that these carbohydrates that we eat in packaged foods today really aren't conducive to health at all. So for the most part, it is very, very much beneficial to be, removing these things and just eating real food.
Mm-hmm. And here's a good one for you: is teas and coffees. So hot beverages, do they disrupt any of the bacteria, or do they feed any of the bacteria in our mouth?
Well, you have to remember tea and coffee are ferments, so they are reasonably bacterial friendly. So coffee is a ferment, and certain teas, green tea isn't fermented, but it's a natural substance. So they actually have been shown that so black tea, for instance, has certain antibacterial uh, effects on the oral microbiome, and that's not necessarily a good thing. But what it shows is that it may release certain antioxidants or certain phytonutrients that inhibit bad bugs. So these kind of foods, and comes from a plant, that's raised in certain ways that it's usually beneficial for the oral microbiome. So teas, I think coffee as well there's some studies that show that it's beneficial for the microbiome as well. So there's generally these unless we're having too much of them, they're beneficial.
And they don't damage the teeth in any way, because some people might limit their coffee intake thinking that, it's mainly for the staining effect, but it doesn't have just the heat or the substance itself doesn't have any detrimental effect to the tooth.
If you've got healthy tooth enamel, and so there's obviously some other factors there, having hot coffee, really isn't going to do any damage. The problems start coming in once we start adding kind of additives and sugars and everything else. So there's the staining is, it really is more, there might be a plaque buildup factor that predisposes certain people to staining. But besides aesthetic, there's really not a lot that's a problem due to coffee or tea consumption.
And then when it comes to fruits, are you a fan of fruit for when it comes to how it affects your teeth and gums?
So there's nothing wrong with fruits as such, but something I do in the book is that I try and put perspective on fruits, that it really is a perspective, a source of sugar that we really don't get a lot in nature today. So look, a lot of the fruits that we see, on the supermarket shelf, like bananas, and then they're very different from what they were, generations and generations ago. And we've grown them in a way so they're big and juicy and full of kind of, sweet fruit juice. But they are a source of sugar that we just get far too much of. And so natural sugar, acts very much the same as refined sugar. Fruit juice, for instance. Kids, today, people will have a big glass of orange juice. You're giving yourself a dose of simple refined sugar there, because you don't get access to fruit juice in nature. Hunter gatherers didn't go and kind of squeeze oranges and drink, or kind of make smoothies out of ACI berries and things like this. So I try and ward people off those kind of things, because it's taking, the way I put it is like simple carbohydrates out of their context, which is within a complex carbohydrate fibrous casing, which fruit is. But I just try and get my patients to understand that fruit should be taken with a little bit of caution.
Okay. And then I guess with vegetables, are there any particular vegetables that are not ideal, or they should be prepared in a different way, because people, if they eat them raw, it has a negative effect, or if they should cook them on their teeth?
I like vegetables for the most part. Look, so certain vegetables, our digestive system can extract more nutrients from them when they're cooked. But for the most part, I do try and encourage people to have a wide range of vegetables with mixed raw and cooked, because you have to remember the raw and the chewing factor in chewing a raw vegetable is beneficial, because it's going to take you longer to chew, and your biome has to break down that fiber, and so cooking will automatically do that. So by having raw, a certain amount of raw vegetables, throughout the week, you're introducing that breakdown factor, and you're feeding those potentially probiotic bacteria that have to break down that fiber that you introduce to the mouth when you chew on a raw vegetable.
Because that was actually something I wanted to get into. I was thinking that certain foods must be more beneficial because of the chewing action, I like how you're already saying that also feeds into the enzymes that need to be released because the longer you chew, I guess. Is that what's happening? If you get to, as we're told, you always have to chew your food, and what you're saying is, chew your food to feed your microbiome.
Absolutely. It's very much a factor of, because in Ayurvedic medicine as well, they used to say that you should chew once for every tooth, which is like 20 times, and your digestive system begins in the mouth. It releases saliva, and people that have chronic digestive problems today, they're likely not chewing enough. The process needs to begin in the mouth, and so introducing foods, and you have to remember that we are really designed to kind of rip and tear and kind of chew for long times, and that does have a biological flow on in the body.
Yeah. So what are your views then on, we're talking a lot about good bacteria, bad bacteria, and trying to get that to a more healthy state. Probiotics, are you a fan of using those? And do you even get probiotics more for your mouth? Because most people take it as a tablet to get into their gut, not actually swill something around their mouth.
So there are oral probiotics specifically for dental conditions. So certain species, so lactobacillus species, there's a set of probiotics called the Bliss probiotics, K12, that actually, so Streptococcus salivarius, that is found in, what they've found is they've isolated from people's oral microbiome, they have more of these bugs. And so you can get oral probiotics, and they can be effective for tooth decay, gum disease, bad breath. Now, I just like people to take a kind of, take that with a grain of salt, is that you're introducing one species to, it's like a grain of sand to a whole beach. So in certain people with conditions, I think that they do have a role, but really having foods like ferments and kefirs and kombuchas and foods that are naturally cultured, you're introducing these species in their in the form they're meant to come from. So I like to try and take you really should. With the microbiome, we know so little comparatively to what's out there. So thinking that we're going to fix everything with a probiotic, I think, is a little bit short-sighted.
Mm-hmm. And you don't have to get the benefit to this stuff too. You don't have to keep swirling around your mouth to think, no, I've got to physically move it around everywhere in my mouth to stimulate these guys. It's just, as you said, changing your lifestyle to expose yourself more to it, rather than trying to force it in there in one go. I'm also interested, we're always told, well, as kids with marketing, was that you have to have milk for good, healthy, strong teeth. Do you think that people have to have milk?
You don't have to have milk as such, but there is what I think, and this is what the Weston A. Price book really taught me, is that there are a certain set of foods that are absolutely critical for our teeth, and that is tooth decay, the development of the dental arch, so crooked teeth, and these are the foods that contain the fat-soluble vitamins. And so milk and dairy is a food, and there's not many of them, that can be a source of fat-soluble vitamins. And so instead of, people talk about calcium. Well, calcium's, eating comes from vegetables, and you can get it from bone broths or dairy, but I don't think that's the issue. It's how your body uses the calcium is the big factor, and what's the major proponent to that, and it's vitamin D. And so, we think now that as European populations moved into colder climates, they evolved the gene to have lactase tolerance. And so that's why they, for instance, began to become hunter-gatherers and begin to drink milk from a cow that they would keep. And if you think about it, humans have done this all over the world, in sheep, in camels, in goats. We do this and we drink their milk. So the important thing is to know is that what the reason why people treasured it, and that was for the fat soluble nutrients. Now, milk that we get on the supermarket today, unless it's been raised from a cow that's seen sunlight, that's had grass that it's supposed to have, that can convert those fat soluble nutrients A, D, and K2 into its cream and full cream milk, not low fat milk, by the way. So there is a perspective on milk. We do have problems with it, but the reason I think why people did have it for many generations before us is that it was a source of these vital nutrients for our teeth and mouth.
Mm-hmm. And so you are a fan of dairy, and as long as it is more like the grass-fed dairy. Do you have any views then even on something that, like raw dairy, which it seems to be quite popular too?
Yeah, well, I mean, raw dairy, you have to remember the pasteurization really only came in the early 20th century. And so what raw dairy is it has all of the amazingly diverse bacterial species that milk is supposed to come from. So I think a lot of the problems that we have from dairy today is because we have pasteurized, homogenized dairy sitting on that is completely sterile compared to what comes out of a cow's udder. And that's what our digestive system was designed to have. And, we've just been talking about how diversity in the mouth and gut is crucial to for general good health. Well, we've taken that away via the way we boil and treat cow's milk now. And so what we see on the supermarket shelf is very different. So look, raw milk's a difficult one because you really have to be close to the source to know that it's not going to spoil. But the principles are there. Probiotic bacteria, diverse, and milk that has come from a naturally raised animal that's rich in fat soluble vitamins.
Mm-hmm. So you mentioned K2. If we could just talk a bit more about that then, because what are some of the natural sources of K2?
Okay, so K2, for those that aren't familiar, is converted in animals from K1. So the molecule is called a phylloquinone, which is K1. K2 is a menaquinone, and there are different types of menaquinones. And so there's menaquinone 4s and menaquinone 7s. Menaquinone 4s come from your animal products, so your grass-raised butter, organ meats, egg yolks, fatty fish, and dairy like full cream milk and so forth. And so what your MK7s come from, they're bacterially derived, so they come from your natto and fermented foods. And so really there aren't many other foods that provide vitamin K2. And so the reason why it's so important is because it works alongside vitamin D. It goes along and activates proteins that carries calcium out of your soft tissues and into your bones and teeth. So you've actually got proteins that are released in your teeth that are vitamin K2 dependent. And so if you don't have enough K2, which nearly, we don't eat enough of the nutrient because we've barely heard anything about it. Well, we lose that inner immunity to tooth decay, and also the flow-on effect is we have weak bones, we have calcified arteries, we have all these other problems that go on because we don't eat enough of this crucial nutrient.
And so do you think then people who are more on a ketogenic diet with dairy and butter, I'm guessing they're getting ample K2, are they?
If it's grass-raised dairy, so if it's coming from so butter and ghee. Now, the amount of K2 in butter and ghee is actually quite small compared to, for instance, organ meats or the richest sources. So natto has a very high source of MK7. You still get K2, yes, though from yogurts and milk and creams and whatnot, but it's got to be full. You have to remember it can't be low fat because a fat soluble nutrient has to come with the fat package in nature, and that's how you digest it as well. So if you're having full cream naturally raised dairy from a grass-fed animal, then yes, they will be getting enough K2.
Okay, yeah, I'm just thinking sometimes when people are on different diets, they get worried about deficiencies, and we're talking about fat-soluble vitamins here. and I'm just guessing, typically when people are more on a low carb or ketogenic diet, they're trying to eat loads more fats, and so they should, in theory, be getting loads more fat soluble vitamins.
If you're having enough, I would say that in most part, yes. But for instance, I would make sure that I'm having some organ meats, so some grass-raised liver. Make sure, lots of egg yolks from, again, organic chickens, and you making sure that your dairy is grass-raised too.
And so then, I don't know if you've seen, but there's a new sort of diet that's up and coming called the carnivore diet, so the all meat diet. Do you have any thoughts then, if someone could get enough, I know you said organ meat, but if someone isn't eating organ meats, would they maybe not be exposing themselves to enough fat soluble vitamins by just eating ribeye steaks or sirloin steaks and fillet steaks?
I think it's very possible. I think that's where you'd want to be testing your levels. So vitamin D, for one, you want to be testing so if you live in the UK, for instance, and you're not getting sunlight regularly, which obviously nearly everyone in civilization doesn't get enough sun now, and we're chronically vitamin D deficient, I would be testing that, and to make sure, because our diets don't provide enough of these nutrients, and they also, if you aren't eating organ meats, which every culture did, across, you can find an organ meat dish in nearly every culture. So if you're not eating that today, I would test your vitamin D levels, because it's a very small set of foods that you do get it from.
Okay. So are you using vitamin D testing as a surrogate marker for vitamin K in a way?
So K2, K2 is difficult to test for in the book. There are some tests out there in the US, I think, that are showing levels of decarboxylated matrix GLA protein, which is the K2 dependent protein, but they're not 100% effective. So look, vitamin D, what the vitamin D levels show is that the active levels in your blood, and so what that tells you is that that's going to be activating and preparing the body for and filling up calcium in the body. And so that means you're going to need K2. So you can just assume that you need K2. Now, there's no marker of overdose of K2. What all it does is activate proteins. So D is much harder to convert to its active form in the body from sunlight or from D3 from the diet. But you can test that in the blood. But so you know that D and K2 go together. So if you know that your D levels are right and you're having enough K2, then you can kind of assume from there that things are going okay.
Mm-hmm. And I saw recently on Twitter you got to reply to a question where someone was talking about tartar and plaque, and I wanted to ask you about that, because it seems that maybe as a side effect that some people have when they are on a ketogenic diet or a low carb diet, I'm not sure if it's just particularly with those diets, but they might have a buildup behind the bottom front teeth. Is that more on those type of diets, or does everyone always have a buildup behind the bottom front teeth?
What I find, so the people that have the biggest buildup behind the front teeth are people that are on vitamin D supplements, and so they usually have a chronic disease like a kidney problem, or they might have some kind of chronic digestive problem, and so they've been given a vitamin D supplement and a calcium supplement by the doctor. And so what that does is that it boosts. They do get enough vitamin D, and their body is flooded with calcium, but it cannot deal with all the minerals throughout into the soft tissues. And also the measurement in the mouth is that calcium is being balanced in the saliva all the time, and you need the K2 protein, so this is matrix GLA protein, to pick up the calcium and then actually take it into the teeth. Now, if you have tartar buildup, which you should only have a very light buildup, and people get very pathogenically, millimeters of tartar, and I've found that it is related to their K2 intake. So you supplement them with K2, you can reduce that buildup. Whereas, for years before, they would always have this caked on buildup, and you can look it up on the internet. It's that you really see some pathogenically thick tartar buildup, and I think it's calcium buildup and lack of K2, and there might be enough D in that state, but you may not have enough K2.
Yeah, I found that interesting. So someone who wants to do like a self-check, health check on their teeth, they can look for bleeding gums and just general how their teeth are and sensitivity. But that buildup behind the bottom front teeth is another good marker to see if you're maybe needing to address something, in which you're saying you do. Because I'm wondering, we were talking about ancestral teeth. They all had a bit of plaque then, did they, behind their bottom front teeth, because the saliva glands are there?
Yeah, exactly. There's a saliva gland at the bottom of the mouth there that feeds out calcium-rich saliva straight onto the teeth. So we all get a bit of buildup there, but what kind of happens in people, I see in 3 to 6 months in people that have pretty good oral hygiene, they get quite a thick buildup. It's a very thick white buildup, and so you can kind of like tip your face down and look in the mirror behind the teeth. It's a little bit hard to see, but you can check if you do get that buildup. I would be thinking that your body's calcium metabolism isn't probably where it should be. And the thing you should be concerned about is that one of the best markers now for cardiovascular health is the coronary calcium score. And so vitamin D, vitamin K2, they are very much linked to how we remove calcium from the arteries and other soft tissues, kidney stones, prostate problems. And the reason why K2 is so crucial for all this is because it's removing it from everywhere, including that piece there. So I would definitely be, it's a good marker, and it's an effective way, going to the dentist and getting your calculus score from them. You'll know whether your diet's perhaps managing calcium in your body as it should.
So how does the calculus score work? What would I ask a dentist there in that situation? Is there a specific number or range that someone wants to be within?
They'll mark whether you have calculus buildup, and if you do, they might be able to tell you whether it's they'll measure the pocket, which is the pocket of the gum, but they'll also measure the amount of calcium there, and so they'll tell you whether it's a heavy buildup and so if it is a heavy buildup, and if you get it clean and you can feel that there's significantly quite gaps between the teeth, you'll know that perhaps that you had a little bit of a imbalance, and you can tweak your diet from there and see if you can prevent the buildup from there.
Okay, so in that case too, someone might notice that they have a clean, and then they take vitamin K supplementation, and then they don't get the buildup again over the next 12 months or so, or it's significantly less.
Yeah, I've seen that happen quite a lot. I've seen people that have quite big buildup, and then once they tweak the diet and take a K2 supplement, even with not that much oral hygiene change. So the oral hygiene will matter because you can clean off the pellicle off the tooth. It will stop the calculus buildup, but the real pathogenic calculus buildup is your body managing calcium. It's not an oral hygiene thing.
Yeah, the reason I'm talking about this too is I knew that the mouth has a link to the cardiovascular system, and previously it was more to do with if you had bacterial infections in your gum, and then that could travel and cause issues with the valves in your heart. But just knowing too that managing the calculus, the calcium buildup around your teeth, is another biomarker potentially to think about from a cardiovascular point of view, from a heart health point of view, is a fascinating health check, I think, for someone to do on themselves.
Absolutely. The coronary calcium score, that it's quite an expensive test to do, but there are studies out there showing that it's one of the most effective in measuring your cardiovascular health, and it makes complete sense. If you're getting calcified arterial plaques in your arteries, things aren't going well. So, and that's the link. And so the heart and gums link has been very vague, and that we thought it was based on an infection basis due to bacteria traveling from the mouth and mimicking certain bacteria that then cause aortic problems and so forth. But the real cause, I think, is the nutrient deficiency in fat-soluble vitamins.
Yeah, that's fascinating. So what are your views then when people try to eat sort of different pH diets, a more alkaline diet, for example. Is there any value in that?
I don't think so. I'm not I don't think that acids have a role in the mouth as well. So when you have apple cider vinegar, for instance, or uh, when you have probiotic species in the mouth, they release acids that inhibit certain species. So I don't think that you know maybe for certain conditions, but I think overall, having a whole food diet that's across the range, making sure you're having enough of these nutrient dense, fat soluble vitamin foods. I think that's more of the core human diet rather than trying to balance the pH. Your body balances pH by itself, and we have trillions of bacteria that have a metabolome. And so letting them do their work, I think, really is the bigger message rather than eating a pH focused diet.
Okay, and so no value in doing like saliva pH testing?
Oh, I think that the oral microbiome is probably, I think it's one of the most exciting, probably, frontiers for biohacking, because you think about the information you can get from your mouth. It is really very untouched in terms of, sequencing the oral microbiome and the extrapolation, what you can do to the gut microbiome. And that's not taking a stool test. It's a very simple saliva testing. We can take our DNA testing from the saliva now. The amount of information I think we're going to take from the mouth in the not too distant future I think it's the future of healthcare, really.
Mm-hmm. And but more to do with pH testing, the simple strips you can buy at a chemist. Would you see there's any value as a health check?
That can show you whether your salivary ducts are your hydration levels are, their calcium metabolism. So if you do have a acidic pH in the mouth, I think that would, it does give you some markers there at least to show that, perhaps your diet or something, your body's not quite managing, the pH in the mouth as it should be.
And then that could affect the actual of the teeth, the enamel, and how they are, I'm guessing.
Well, absolutely. Yeah, the pH is crucial. That's how, and they control it intrinsically themselves, but it is a critical factor in dental disease.
Okay, and another one for you, talking about still with the microbiome, because that's been the focus so far, is mouthwashes. And I know you have a good point of view when it comes to should we use a mouthwash or not.
Yeah, so I think across the board people should not use mouthwash. And there was a study that came out at the end of last year that showed that people that use an alcoholic mouthwash every day actually increase their risk of pre-diabetes. And so the link there is that we know that we lose diversity in the gut in type 2 diabetes. And so we're showing there that if you introduce an antibacterial into the mouth continuously over your life, you decrease the diversity of the oral microbiome, which communicates to the gut microbiome, then you're increasing your risk of systemic disease like type 2 diabetes. So, that's one of the, I think it's obvious, how connected the mouth is to the gut, but that's, research really kind of panning that out for us.
Mm. And oil pulling, any views on that to try balance out the mouth or to detox?
Look, the research on it really isn't there, but I mean, logically, introducing a fat into the mouth, most of the problems we have is simple carbohydrates. So I think the effects on the biome of introducing a fat-based kind of swish, I think probably would have a positive effect on the mouth. And it was used in Ayurvedic medicine. But my recommendation is just to eat more fat, have more fat in your diet, and your teeth will be healthy because you're feeding your body what it needs. So that's really kind of what I tell people, is to eat more fat in your diet.
So that's just to sort of recap on what we've talked about, because we're coming up on time, I can see, is that it's get a lot of good healthy fats so you can get all those fat soluble vitamins, chew your food properly so that you stimulate different enzymes produced, and also eat a diet that's going to feed that biome. All of these things are going to feed back and make your gums and your teeth healthier and stronger for the long term.
Absolutely, yeah. And probably one other thing is, the sourcing of your food is important too. And so we talked a little bit about different types of dairy, and your mouth is basically listening to everything that you put on your plate. So it's remarkable how much power we have on our dental and whole body health.
So, Steven, for anyone who's listening, if they want to follow you, keep up to date with you, find out more, what are some of the social links or some of the references that you would recommend for people to follow?
So my website is www.drstevenlin, so DrStevenLin.com. I'm on social media at Dr. Steven Lin. And so I try and post a lot of things about functional dentistry and, the food and diet and mouth connection. And so come along. And so my book is available on Amazon in the UK, US, Australia, The Dental Diet. And it's a journey through what we've talked about, basically, that there's a big story that's written in our teeth about how to live a healthy life.
And I'll link to all of this in the show notes for everyone. I just want to say thank you again for sharing so much information. There's so much more I could pull out of you, but I wanted to keep it mainly around food today. So hopefully I'll get you on again to talk about some more biohacking of the mouth and the body.
That'd be great, Gary. I look forward to it. It was a pleasure. Thank you for having me.